Thank you so much. And speaking of giving back to the world, right? We see that human rights are in full form. However, at the health forefront, women are always left on the side banks. And in wake of this, Pakistan is taking a nationwide initiative. Cervical cancer is one of the most deadliest cancers of the world. It is one of the most common cancers of the world. And what is truly heartbreaking is that it is the most preventable cancers at the same time. However, Pakistan is launching a nationwide campaign to combat this. The campaign will run till September 27th, and it is going to target over 13 million girls, which is highly exceptional. And to help us understand the importance of this campaign, we have Ms. Kinz Ul Eman.
Kinz Ul Eman, who happens to be Chief Executive Officer of Dopasi Foundation. Hello, Madam. Assalamu alaikum. Good morning. How are you feeling today?
Walaikum assalam. I'm good. I'm excited that the country is finally taking steps with all the efforts that have been put together.
I think that's wonderful. Thank you so much for joining us. Wonderful to have you over here. Just right at the beginning of it, imagine that just yesterday, Ashar, one of my very dear friends, actually texted me saying that you people are here, and we certainly were talking about it as a team that we need to do a segment on cervical cancer and how these vaccines, which will be, I think, given to all of those girls aged from 9 till 15, if I'm not wrong, will help and protect them from cervical cancer. The only thing, when the segment was logged, Ashar didn't even text me, thank you, yaar, and all of that.
So yeah, take us through cervical cancer, what it is, and how is it related to HPV?
So basically, cervical cancer is one of the most deadliest cancer. Every single minute, a person is diagnosed with cervical cancer globally. Every 2 minutes, a person affected by cervical cancer actually dies.
Oh my gosh.
So it's one of the most deadliest cancer. If you get breast cancer, the chances that you will survive are 50% higher than if you get cervical cancer, you're going to survive. And HPV has almost over 100 variants, 2 of which cause over 88% of cervical cancer in Pakistan. So that HPV vaccine basically gives immunity to women, and so that virus, when it impacts, it doesn't convert into cervical cancer.
All right, that was very informational and educational. We did not know that HPV had so many variants, and 2 specific variants can target women. So why specifically the ages of 9 to 14 are being targeted for these vaccines?
If you see, this age is basically when it's going to be most effective. In Saudi, they're giving this vaccination up to 23 years of age, but the most globally recommended and the most effective age is basically in between 9 to 14 years of age. That's why the government has targeted to in this initial campaign phase, we're targeting 19 to 14 years of age.
Thank you so much for highlighting that. And speaking of vaccines, right? So we've seen a lot of controversy regarding the corona vaccines, how it's affecting a lot of people regarding health issues, heart issues, nervous system issues. So what are the you could say the lack of awareness regarding vaccines, and maybe what people do not really know about them properly? The fears.
The purpose of HPV vaccine is just prevention of cervical cancer. Linking HPV vaccine with the myths prevailing around causing infertility, it is WHO recommended. It is halal, else countries like Saudi Arabia, Malaysia, UAE, Indonesia would not have already rolled out these vaccines. It's not, Pakistan is not the first country to be initiating the campaign for HPV. It's been there for it's already happened in over 149 countries. Pakistan is going to be 150th country to actually roll out. We should be grateful that we have gotten access. One single dose actually costs somewhere around 10,000 for one dose. And we are fortunate enough that now the disease that was causing us over 3,000 deaths annually, over 5,000 affected by cervical cancer, and yet we need to keep this into mind that the reporting of cancer in Pakistan, the numbers may be super huge, but these are the numbers that are reported, that are recorded there. So it might be huge. So the purpose of HPV vaccine is prevention from these deadly diseases. Exactly. We should take this as an opportunity and actually save the precious lives of our girls.
Exactly. And at this point of time, I think let's speak about the campaign itself. So how do you think that there will be community mobilization? How do you think that there will be more awareness campaigns amongst people? Because 13 million vaccines to be administered means that we really need to kind of go and educate the parents of the girls, first of all.
Exactly.
That, hey, you know what, it is to, you know, safeguard your daughter.
And what role is Dupasi playing in this campaign?
So what the government of Pakistan and the Federal Directorate of Immunization (FDI), supported by Gavi, WHO, and partners, is basically leading the campaign. And there is in the first phase we targeting Sindh, Punjab, ICT, and then in the recurrent and AJK, and in the recurrent phases they're going to be KPK, then Balochistan, and GB, I assume. In this what they're doing is initially it's going to be launched in a campaign mode starting today up to 27th, in which mobilization has already been done from the last 3 months. Awareness in schools, awareness in hospitals, private sector hospitals, gynecologists, religious scholars, leaders, influencers has already been done. Now from today onwards, vaccine administration will actually start at various levels, including schools. So if your school sends consent form, kindly sign those consent form and send them back. Then if you want vaccine, there will be community centers across the city. If we talk about Islamabad, for example, then the vaccine will be available at all the public sector facilities as well.
And it's great to know that it's widely available for all the people to access. But the main point is, for all the parents watching, what are there any side effects of the vaccine? How safe is the vaccine for kids?
There has not been any key side effect that has been reported, any kind of serious side effect that has been reported.
Effects, I think
any serious side effect. If you link the HPV vaccine to infertility, that is not there. There is no global evidence around that. Minor side effect, like any vaccine, obviously there is going to be a small spot for the time being, feeling minor fever. It's not associated with any high grade fever or anything. Minor fever or having slight pain at the spot, just like other EPI vaccines that you normally get for your children. That is the only side effects that have been reported that might be felt. Again, these side effects are rare.
And how effective are these vaccinations?
This vaccination is over 98%, 95, 98%.
So 2%
effective.
They will still be charged that even if you have been administered or by the vaccine, you might still get cervical cancer, unfortunately?
Up to 95% success rate is super high. So let's target to get the vaccine to have 95%
when we sit over here, there's greater responsibility on our shoulders. There are parents out there who are listening to us. I'm all for vaccinations and I would want people to go out there. But since we have not had a discussion with the doctor first, so I would want them to kind of make sure that they do their own research. See, that's something which is essential. I do know how you're working, and that too in the favor of the race that we call humans, but I think everybody needs to put in their effort.
Scientific research has been done. WHO has recommended this. Global research has happened. In our country, gynecologists have vetted this, and the government or the Ministry of Health is doing this after evidence in 149
and that's where I will
countries.
help you now. And that's where I will help you now. For all of those people who are out there, ladies and gentlemen, that it's a joint venture in between Federal Directorate of Immunization and Gavi, the Vaccine Alliance. So I think that when the government steps in, I think that it is for the favor of people. I think I would want to kind of pay rich tribute to our government and the people who are at the helm of affairs for making sure, and to Dupasi as well. You guys are doing a wonderful job. And for parents, please make sure that you do your own research. We have brought you that this is a great vaccine. It has been tested in 140 different countries, 95% success rate, no severe symptoms. The rest, it's your choice. You want to protect your girls from cervical cancer? This is your high time that you get the vaccination, which is being administered for free by Dupasi. Thank you so much for being with us.
And I think we really need to applaud the efforts of such campaigns and initiatives.
And thank you so much, Asher. Thank you so much for giving us such a wonderful
for all
guest.
the people who have